We're back on MD-VOD, and today we're talking about prostate cancer, and we're joined by prostate cancer expert Dr. Paul Pagnini, and we're here to answer your questions online. First up, Dr. Pagnini, is Samantha Bentford on Twitter. Is this a slow-moving cancer or something to address immediately? The question.
It can be a slow-moving tumor. What we were talking about a bit earlier, if, again, the Gleason score or the grade of the cancer is a lower one, a Gleason 3+3 equaling 6, it very well may be a slow-moving tumor, but active surveillance will ultimately tell if a patient has a slow-growing tumor. That can just be kind of watched and surveyed as it goes forward. But other times, prostate cancer can be quite aggressive if it's a high Gleason score active tumor. So there's a lot of disparity between how aggressive and how fast they move.
I have a question about that. The active surveillance, that's interesting. I didn't know that's a great idea and concept. So let's say you identify someone that's got a fast-growing prostate cancer. How often do you see that? Is that the minority, the majority of cases?
It's not the majority of cases. It's certainly, and it's under the mean. It's lower, but the problem is that they can become so out of control with lymph node metastasis or distant mets if they're high Gleason grade cancers. So somebody with a high Gleason grade or even an intermediate, a Gleason grade of 7, is not going to be a candidate for active surveillance. So active surveillance really is only for those low risk, low grade cancers. So I want to clarify that for sure.
Got it. Great point. Next is Allie Kaplan. Is there anything that you can do to lessen the pain associated with prostate cancer or treatments? Good question, Allie.
Very good. Many men have metastatic cancer with prostate cancer, and prostate cancer predominantly goes to the bones. Bone metastases are painful. Radiation therapy is often used and is very effective at palliating bone pain from prostate cancer. So a single treatment to an isolated bone in the arm or leg can be extremely effective, or up to 2 to 3 weeks of treatment for maybe vertebral body bones or hip bones. It just depends on the location, the degree of pain, and the overall status. But radiation can be very effective at alleviating pain for metastatic prostate cancer. Also, hormonal therapy is used in this setting, and other palliative care options such as narcotic medications.
Oh, great answer. And good question about pain associated with prostate cancer. Next up is Baseball 88. Other than taking a PSA, what is the best way to diagnose if someone has prostate cancer and also catch it early enough so it's not fatal?
That's a great question, and that all comes back to the PSA. There's no other way to detect it early. So the symptoms, again, are very vague. They often are confounded by benign prostatic hypertrophy. So to catch it early, we don't really have anything other than PSA. I guess you could say, you know, seeing your physician on an annual basis and having a digital rectal examination, if there's a palpable abnormality, that would lead to a biopsy, and that would help to catch it early. You know, it comes back to that PSA again.
So great question. Trumpet player 224, what's the cure rate when you catch it early and when you catch it later?
Caught early, prostate cancer can have a cure rate as high as 90%. Stage 1, stage 2 cancers that are removed with radical surgery or treated definitively with brachytherapy or even external beam can be as high as 90%. So that's really where it's at, getting it early. Catching it late, once it's metastasized, it's not curable, but luckily it does respond to treatment. So hormonal therapy can slow it down, and patients can live many, many years with a fair and to good quality of life with metastatic prostate cancer.
Wow, that's encouraging. So what we've learned is that, look, PSA, even though there's lots of controversy out there, it may be the best test we have to catch it early. And also see your doctor. What a great point. See your doctor, because, you know, a rectal exam is important in catching it early. And also you know, don't lose hope. It sounds like therapy is really helpful for both the pain and in terms of living a long life even after you have metastatic disease. What great information. I want to thank Dr. Paul Pagnini. Outstanding
Thanks
stuff.
for having me.
And if you missed anything on today's show about prostate cancer with Dr. Paul Pagnini, definitely go to emPOWERme.tv, MD-VOD, prostate cancer with Dr. Pagnini. That was great stuff. Make sure you join us next time. I'm Dr. John Kennedy on MD-VOD.